All right, so I think everybody that was in the waiting room is now in our virtual room here together. And so I just want to take this time to welcome everyone to session 1 of the Staff Satisfaction Surveys Learning Collaborative. My name is Suzanne Spear. I'm the Senior Director of Workforce Development, and we're so excited that you guys are joining us today and for this entire series. Next slide, please. So I'm going to be one of your hosts and presenter in this series, and I'm also joined by some members of our wonderful team. So we also have Helen Ray Vernier, who is one of our training specialists at the STAR Center, and then Mariah Blake is our program manager, and you won't probably hear her as much during this series, but she is very much here and a part of this whole experience. She's waving at you virtually there, and she is available to help on the tech side, and you will be seeing probably a lot of emails from her, and she's here to answer any technical questions that you have going through this learning collaborative. Next slide, please. So as I mentioned, we are with the Association of Clinicians for the Underserved, also known as ACU, because let's just face it, the Association of Clinicians for the Underserved is quite a mouthful. So ACU is a national nonprofit membership organization that was founded 25 years ago, in fact, this year, and it was founded by alumni of the National Health Service Corps. And we have changed a bit over the years, but our mission remains the same, and that is access to care for underserved populations, and also the recruitment and retention of a clinical workforce that is needed to serve those underserved populations. We have a bunch of different programs. You can read about them on our website. We have a vision services program. We have a suicide safer care training program for both providers and staff at health centers. And we have a bunch of other different initiatives that we have going on. And you can check out all of those at clinicians.org. One of ACU's largest programs is our STAR Center. Next slide, please. And thank you. And that's why we're here today. This training initiative and experience is funded by the Bureau of Primary Health Care, because one of our ACU's largest programs is a national cooperative agreement or a national training and technical assistance partner grant. And the STAR Center stands for Solutions, Training, and Assistance for Recruitment and Retention. That program was started in 2014, so we're in our 8th year of creating tools and resources for health centers and primary care associations around the nation that are delivered at absolutely no cost to you. So as you guys know, you came in, you signed up for this learning collaborative, and you're able to take part at no cost because HRSA pays us to develop this training for you. So if you're new to ACU STAR Center, we hope that you'll check our website out at chcworkforce.org. And if you have been there, but it's been a while, we encourage you to check all of our tools and resources out because we are constantly updating this. Next slide, please. So now that you know a little bit about who we are as a faculty and as ACU STAR Center, wanted to sort of change gears and get into our learning collaborative. So a few housekeeping items. We go over these during every session. We just like everybody to know, but especially it's important as we are getting into our first session together here. So first of all, this session is being recorded and will be posted on the discussion board. So if you want to go back to any of the sessions, so after the third session, you're like, gosh, I really wanted to go back and listen to the first session or the second session, whatever it is, there will be there posted there on the discussion board, and we'll talk a little bit more about that in a second. Please be as present as possible during this experience. Feel free to turn your camera on. I know some folks are in a situation where they can't, but we would love to see your faces and be able to connect with you visually in that way during our experience. You can always use a chat box during our time together. You can also unmute yourself. It's a relatively small group, so we have 18 of us in this room, including the 3 faculty that are here today. We want you to be able to engage, ask questions, share comments, or thoughts that you have. We really don't want you guys to be shy. So either you can vocalize those thoughts or comments, or you can feel free to utilize the chat feature and share with us that way. As I mentioned before, Mariah Blake is here to be your technical guru, the wizard behind the screen, and she is definitely here to do that. So feel free to message her directly if you're having any technical difficulties, or you're not receiving emails or things in between sessions and things like that. We would also love for you all to complete evaluations at the end of the session. We know you guys are doing a lot of evaluations lately, but it really, really helps us. Our funder, BIPIC and HRSA, it's a requirement that we have. So we would love to know what you guys think. We would love your feedback every single session. If there's something that you feel like we could be doing better, we have our curriculum and our time planned out together, but we want to know what you guys think and how we can be doing better and making this an amazing experience for you guys, because you guys are taking your valuable time out, and we just want you guys to feel like you're getting the most out of our time together. Next slide, please. All right, so today's agenda, we've got an action-packed agenda here for our first time together, and we're really doing a lot of introductions, a lot of level setting, a lot of getting to know us as a group, a lot of getting to know you all as a group, and also really sort of laying the groundwork about what we're going to be doing over the next 5 sessions. So we're going to be talking about that purpose and goals of why we're here in this Learning Collaborative. We're also going to be talking about the methods, how we're going to be doing things in the Learning Collaborative, how we're going to be learning and engaging with one another. We're going to go through a centering activity for just a little bit. And then we're going to do some cohort introductions. So again, y'all got to know us and who the faculty are, but we want to get to know you guys, and we want y'all to be able to learn from each other and learn who is here, where you're from, all that kind of good stuff. And then we're going to get into sort of an intro about the staff satisfaction surveys and why we do them, how we can respond, all of that, really scratching the surface of things we're going to dig into deeper during our time together in this Learning Collaborative. And then we'll wrap up, give you guys a little assignment, and get on to next steps. One thing I wanted to mention, thank you for changing the slide, perfect. One thing I wanted to mention is our time together is slated for 75 minutes. We might not take that whole time today, but we wanted to be able to give you guys a chance to share with each other and with us. And so building those extra 15 minutes in per session, we really felt like was a valuable thing. And so if you all had more to share or were really getting deep into conversation, we didn't want to have to cut that off in order to get to some additional content. So just wanted to point that out too. So our Learning Collaborative goals. So as I mentioned before, we are here to learn we're here to do a lot of learning. And I hope that by the end of this, you all will feel equipped to either implement and respond to staff satisfaction surveys for the first time, or level up what you're doing in regards to your staff satisfaction surveys if you're already engaging in those. So we're going to learn from materials presented. We are going to learn from some expert faculty. So you'll not only hear from Helen and myself during this experience, but we also have some expert faculty that we're really, really excited for y'all to learn from. We're here also to share challenges and strengths. This is a really rough time for everyone, especially people in healthcare, especially people who are serving in underserved areas and underserved population. And so we are here to be a support group for each other and really want you guys to be able to share your strengths and challenges there. We want you guys to really have questions and be inquisitive and ask questions about of faculty, ask questions of each other, and really have that learning there. And then on the other side of that, we hope that you guys leave with knowledge, new ideas, things that you're going to change, new processes that you're going to place. And finally, with those new knowledge, we really hope that you'll be able to develop and implement a strategy for implementing and responding to staff satisfaction surveys at your health center. Next slide. So with that, so we just went over all of our goals. So now we're going to really talk about what the type of tools that we're going to be using during this learning collaborative. So some of our time together is going to be focused on didactic presentations, right? So there are live sessions. You're going to be receiving content, learning from materials that are presented. And also during our sessions, we're also going to have time where we're going to have some dedicated time for discussions. We're going to have breakout sessions so you all can talk about assignments, challenges, things that you're really learning and really want to talk and have some focused and dedicated time together. In addition to our live webinars with discussions, we're going to, as I mentioned, we're going to have some assignments for you guys to have. And we really want these to be a lift that is going to be minimal but meaningful, right? And so there is a lot going on, but by having something that you are taking away from each or most of our sessions, I'm not sure if you'll have an assignment after every session, but after most of the sessions to get you thinking about the content that was presented and maybe moving forward in the next step, right? Because by the end of this, we want you to be able to have those staff satisfaction surveys in place. And by having those little baby steps, it's our hope that by the end, you'll be equipped to develop those and implement those at your health centers. We have a discussion board, as I mentioned, to for you all to really, it's going to be a central repository for you all to have a place to access all the materials. So each recording is going to be posted under each week. You're also going to have access to the PowerPoint for each week. So you'll be able to log in, access the recording, the PowerPoint, and then also ask any questions there. And if you're having any trouble accessing that, I know you all probably just received a login this morning. Feel free to reach out to Mariah and she'll be more than happy to get that to you. And finally, our last sort of piece of the puzzle when it comes to the tools that we have in this learning collaborative are follow-up and check-ins. So as a requirement of our NTAP through our National Training and Technical Assistance Partner Cooperative Agreement through BIPIC, we're required to follow up with you all somewhere between 3 and 6 months after we wrap up this learning collaborative and check in with you guys to see, if you're implementing what you learned, and if you have any pitfalls or questions for us, and then it's our intention to follow up at least once with you during this learning collaborative. So we'll be checking in with you guys at least once during the learning collaborative, and then at the 3 to 6 month period after our learning collaborative is over. Next slide, please. All right, so I mentioned this before, but just kind of wanted to bring it back to the forefront here, and this is also in your welcome packet as well. So, our learning objective. We want you all to understand the components of the staff satisfaction surveys, really understand the value of conducting them and how they really inform leadership about what's going on and how they can also increase employee engagement. That's so important with everything that's going on in the world right now. We're going to understand how to really conduct them, and also how to follow up with how to follow up on them, and then also action steps that can address any issues that come up during, that are discovered during the staff satisfaction survey. So those are the learning objectives, and then the outcomes, just as I mentioned before. So it's our hope that you all will be able to implement a staff satisfaction survey at your health center, and then implement or update 3 policies and procedures as a response to information gathered in those surveys. So when we say 3 policies, this is not necessarily something huge that you have to do differently, but there might be a policy that you want to implement, whether it regards to benefits or time off or whatever it is that you're going to implement or really look into. Really 3 things, because I think that's a manageable amount, and it is our hope that really you can move the needle by doing those things as a result of this learning collaborative. Next slide, please. All right. So now that we have had a chance to sort of level set with our learning collaborative, really understanding why we're here, how we're going to do things, how we're going to learn, and what we're going to get out of our learning collaborative, before we dive into getting to know each other, I wanted to take just 60 seconds. You guys are really busy. There is a lot going on at your health center. So what I'm going to do is give ourselves 60 seconds that we can just sort of turn off, disengage with whatever we left, whether it's lunchtime or the morning, wherever you are. Just wanted us to give us 60 seconds to just sort of level set and just come together and just center ourselves before we dive into the content here. So I'm going to set my clock for 60 seconds. I'm going to turn my camera off. You guys are mostly off camera, but if you're on camera, if you want to turn your camera off, just turn your camera off, take 60 seconds, breathe, meditate, think of a happy place, whatever you want to do. I just want to give us 60 seconds to just bring ourselves into our time together. Okay, welcome back, everyone. 60 seconds. I hope you all feel like you're able to at least just exhale and bring yourself back. So thank you guys for joining us. Okay, so what we're going to do now is we're going to get to know each other. And so Helen's going to stop sharing her slides. I'm going to bring up, actually, she's going to stop sharing her slides in just a minute. But before she does that, what we're going to do is we are going to take you guys into a little app called Mentimeter. If you've done some training with us before, you're probably familiar with it, but it's something that we like to do. It's kind of fun, a little different than just doing things through Zoom. So what I want you guys to do is open an app on your, or another tab on your browser and go to menti.com and enter 69168922. Alternatively, you can scan the QR code with your phone and get it up there. So either menti.com, 69168922, or get in or scan that QR code there. So I think hopefully you guys, most of you guys are on there. Thank you, Helen, for allowing me to screen share. So what I'm going to do is, see, you guys are already there. So we're going to go through a series of questions just to get to know each other here. But we would just love to know who's here. So what is the name and location of your health center? Now, is LaGrange in Michigan? What state is that in?
Oh,
Pennsylvania, New Jersey. Sorry. Someone was saying something, I'm sorry. All right, we've got Pennsylvania, we've got Oregon, we have Los Angeles, California. I love it. I always love doing this because I think it's awesome for you guys to see where other health centers are coming from. It's really fun to see all the different geography of places. So Missouri, middle of the country, Georgia, awesome. Okay, awesome. Well, welcome everyone from my corner of the United States to you. All right, so now that we know where most of y'all are coming from, I would love to know, what your role at your organization is. So are you HR? What type of leadership are you in? All of that. Or generalist. Oh, lots of HR generalists, a director of HR, senior VP of Health Center Services, lots of HR generalists. QI, Director of HR, QI and Risk Manager. Okay, awesome. Love it. Okay, yeah, awesome. Wonderful. Well, I'm excited that we have a lot of HR folks, but I'm also looking forward to hearing from the folks that have a little bit different role at your organization and how you all might be able to, really, give us some insight on things outside of the just HR world. All right. Next question. How long have you been in your role? Do we have veterans? Do we have folks that are new? Okay. Oh, wow. This is awesome. So we have obviously a lot of folks who are relatively new to their role, just, really getting into it. But then we have some people who are veterans and have been doing this for a long time. So I'm excited to hear maybe some fresh ideas for the people who haven't been in their role for a long time, but then also really looking forward to hearing from the folks that have been doing this for a little bit and have some maybe some tried and true tips that they can share with the group. Helen, is that the last Mentimeter on for this section? Sorry, just want to make sure I don't go too far.
I honestly can't remember.
Okay, so we're going to see if the next one is now or later. So you guys just hold on with us 1 second.
Just one more. This
Okay.
one is for right now. Yes.
Okay, last one. Sorry about that little hiccup, you guys. Thank you for your grace. So we would love to know what's one thing you would love to get out of this learning collaborative. So what's one thing that you want to share with everyone that you would like to get out? So by the time we end this, in our 5 sessions together, what is one thing that you hope to gain? It can be big, it can be small, it can be anything, really. Okay. A great employee satisfaction survey. So maybe some questions that we should ask on there. Yes. Okay. Excited to dig into that. Utilizing surveys to effectively make change. Yes, absolutely. Really excited to dive into that. We have somebody specifically coming to talk to us about that. Using survey data to enact change, implementing them, creating them, just starting out. Okay. Yes. Just starting out. Yes, absolutely. Rolling best practices for rolling it out and following up. Yes, absolutely. Implementing the results, using data to change. Okay. Learning how to survey staff and implement changing that are meaningful. Yes, absolutely. Well, thank you guys so much for sharing. I hear some themes here about like best practices, questions to use, and then also how to take that, like really what do we do with the data, right? We're collecting this information. If you've done these before, but you haven't really used them to make change, or if you haven't done them before, how do we actually do them? And then how do we take that data and turn it into something that we can do that? So thank you guys for sharing information about yourselves, about your health center and your role, but then also about what you're learning to get out of it. And so I'm really, really excited to turn it back over to Helen, and we are going to get started in the bulk of our content while we're here talking about staff satisfaction surveys.
Great. Thank you so much, Suzanne. And thank you all so much for being here and participating in those introduction questions. Like Suzanne said, we love to get to know you, but we also think it's a really great way for you to get to know your other cohort members. And of course, across the sessions, there'll be opportunities for those discussions and we can get to know each other more. But just for this introductory session, it's a nice way to sort of get a little gauge on who's in the room, what's going on, etc. So yeah, thank you all so much for participating. participating in that. So now I'm going to talk about staff satisfaction in general as, a concept. So staff satisfaction is a measure of workers' contentedness with their job, whether they like the job or individual aspects or facet of their job, such as the nature of the work or the supervision. Job satisfaction can be measured in cognitive, affective, and behavioral components. And of course, just to sort of ground this in some of the Star Center's work at the Star Center, we believe that workforce is the fuel for your health center organizational efforts. Quite simply, if we didn't have a health center workforce, health centers wouldn't be able to see the patients that they're funded to serve and do what they're designed to do. So by having a full fuel tank of workforce, a health center identifies workforce as an essential organizational issue, invests in appropriate operational and staffing resources, and then has some key features. And they might look different at each organization, but these key features or core components of a robust health center workforce remain. They are a data-informed workforce plan, equitable and effective compensation structure, positive culture focused on engagement, tested recruitment and retention strategies, health professions training program, a chief workforce officer, high-functioning managers, and policies that support diversity and cultural respect. And of course, staff satisfaction can relate to any and all of these, and they're all areas worth considering as you begin to plan and implement these staff satisfaction surveys. So that's important to think about. So of course, employee satisfaction or job satisfaction, quite simply, is how content or satisfied employees are with their jobs. And employee satisfaction is typically measured using an employee satisfaction survey. So some factors that can influence employee satisfaction addressed in these surveys might include compensation, workload, perceptions of management, flexibility, teamwork, resources, and many more. And these things are all important to organizations who want to keep their employees happy and to reduce that turnover. So to think about what a staff satisfaction survey is, it's pretty simple, but we just want to make sure that we're all on the same page and that we have it out here. So an employee satisfaction or a staff satisfaction survey is an employee feedback tool that allows employers to find out about the employee experience directly from employees themselves. And we want to be sure to at least consider the differences between staff satisfaction and employee engagement. So they are very similar concepts on the surface, and many people use these terms interchangeably. The importance of knowing the difference between satisfaction and engagement, however, is critical for an organization to make these strategic decisions to create this culture of engagement. Employee satisfaction covers those basic concerns and needs of their employees, and both concepts are definitely important, and staff satisfaction surveys can be designed to collect information on both. This is, of course, just semantics, but we want to make sure that we're mentioning it and talking about it, because sometimes when you start to look into staff satisfaction surveys, if the questions are created with employee engagement in mind, they can leave out some of these really important pieces around employee engagement. And of course, to that end, what's most important is asking the right questions. You can call it whatever you want, a staff satisfaction survey, an employee engagement survey, employee feedback survey, whatever, but just be sure that you're thinking critically and carefully about what questions you're asking and that they're measuring the right factors. It's also really helpful to have access to benchmarked results. If you don't, that shouldn't mean that you don't include a question, but that can be really helpful in helping you sort through what questions are going to be useful. Will you be able to compare it across the industry or across other health centers, or even across years at your own organization? And so through this process of really considering the questions, your organization can construct a strategic plan or an action plan to improve that employee engagement and staff satisfaction, and in turn performance. So then this kind of gets at why we conduct staff satisfaction surveys. And of course, I at least hope that the fact that you're all here means that you think that staff satisfaction surveys are important, but it's still nice to be armed with some of these, solid reasons that you can explain to folks, either at the leadership level, if you're needing to justify this, or to your staff to, they're busy, they've got a lot on their plates, but to help them understand why this is important and how it will help the organization as a whole. So a carefully designed and conducted employee survey, it can reveal a lot of information about employee perceptions that management and leadership can use to improve the workplace. So organizational responsiveness to that employee feedback leads to higher retention rates, lower absenteeism, improved productivity, better patient care and customer service, and then higher employee morale. And the simple fact that an organization is conducting a survey can send a positive message to employees that their opinions are valued. In addition, managers can gain insights into issues affecting their departments or their sections of the organization, and that can allow them to manage more effectively. Of course, conversely, if the senior management team is not fully committed and ready to really listen to that feedback and, of course, most importantly, act on it, then conducting the survey can falsely raise expectations among employees, leading to, the opposite of all of these benefits. So we do want to make sure, as you're starting to think about implementing these, that we're really clear about this is a whole process. It's about creating the survey and asking the questions, but being prepared to listen and answer or react or respond to those answers. And again, like Suzanne said, we have another speaker coming at a different session that will go into that more in depth. But as we're laying the groundwork, we really want to make sure that that's clear and easily understood. And of course, again, as you're arming yourself to think about and talk about why this is important, retention matters, and we all kind of know this, but turnover is expensive. It's more expensive oftentimes than the programs that you're implementing to create that retention. And a staff satisfaction survey or an employee engagement survey can be part of that retention programming. And we want to just highlight, if you've been on a Star Center training, you already know this, but the Star Center has this financial assessment tool that you can fill out that will really help you answer these questions listed here. So what is the actual cost of turnover? What's the cost of a provider vacancy? How much does it cost to recruit new staff? And how much money is your organization losing to these workforce issues? And how can you better invest that money to retain staff and minimize those losses? And if you haven't already, we encourage folks to look through this tool and consider what these costs are of having high turnover, and then you can use that data to make the business case for retention. And of course, we love this quote here at the Star Center that without data, you're just another person with an opinion. So again, going to the importance of that, of both the financial assessment tool and these staff satisfaction surveys. This is your data to show your organizational leadership, show yourself, show your team, show your other employees that what needs to get done and what are the priorities for the staff you already have, and how you can implement programs to keep those staff and hopefully keep anyone that you're able to recruit in the future. And again, we also like to think about how we're presenting data here at the Star Center. So again, we have this quote that data storytelling is the ability to convey data, not just in numbers or charts, but as a narrative that humans can comprehend. Just as with any good story, a data tale has to have a beginning, a middle, and an end, and it needs to be presented without bias and with the proper empathy and context. So again, you're collecting this data, you're implementing these staff satisfaction surveys, and you're gaining a lot of information, but as you're going through it, it's important to be conscientious and thoughtful about how you're presenting that data, making sure that the data is legitimate and it really is expressing the needs of the folks that you're asking these questions of, and then how are you presenting the results so that they can be taken in, understood, and then turned into action to improve the lives of your employees. Again, as folks in this field, you all know that we're in a bit of a workforce crisis right now, and we just want to highlight the fact that that we know that this is going on and that things are really hard right now, and that the Great Resignation is real, but that staff satisfaction surveys and employee engagement surveys can be part of the solution in collecting data to make sure that you're taking this data-driven approach and then identifying those root causes and making some needed changes. So like Suzanne said, as we were working on the centering activity, we know things are hard right now. We know that we're all living through this really stressful global experience. And we know that that's resulting in workforce issues. And we really hope that through this learning collaborative and through your staff satisfaction surveys, you can get some answers to help make this a little easier, and help you understand how and what changes can be made to make everyone's life a little bit better, and encourage that culture of engagement at your organization. So of course, there are various things to take into consideration as you begin to plan your staff satisfaction surveys. And this learning collaborative will offer content, time, space, and a sounding board to delve into these areas more. But for now, for this introductory session, I'm just going to quickly go over some of these considerations to get our wheels turning, get ourselves sort of ready for this process that is the learning collaborative. So some key considerations are listed here, and I'll go through each of them briefly, but it's important to think about the type of survey you'll be using. You need to consider what makes the most sense for your organization. The three most common types of employee surveys include employee opinion and satisfaction surveys, employee culture surveys, and employee engagement surveys. And again, some of that is semantics and they can be melded and mixed, and it's really up to you to design the survey that you want, but it's just important to think about what type of survey makes the most sense for you. It's important to think about timing and frequency of your surveys. Organizations should conduct surveys of employees on a regular basis. Lots of companies elect to ask their employees for feedback annually, but that doesn't necessarily always make sense for everyone. And it is important, though, to think about that requesting regular feedback shows your employees, again, that the company actually cares about how they perceive their work and environment. But choosing when to conduct the survey takes that careful consideration. And again, we'll get more in depth on that later. Again, think about your survey design. Prior to administrating this new survey, you should spend time looking at any previous surveys and their results if you have conducted them in the past, and ask questions like, what's the driving force behind the survey? Is it simply because it's time to do another survey? Is the survey tied to the business and organizational strategy, etc.? Lots of organizations find it useful to form a multi-level cross-functional team to consider the organization's key objectives for conducting a survey before designing it. Also think about policy issues. Most organizations do not need to develop policies about the conduct of periodic surveys of employees, but the employer's internal policies and practices, as well as any labor contracts, should be consistent with existing policies, rules, or labor practices. And then also think about any legal issues. For employers, the greatest potential legal concern is that if you're using a third-party survey provider, is that company might have infringed on the copyright of the original survey author, and created a pirate or a counterfeit survey. So that's just one thing to think about if you're using a third party. And then you should look, so if you are using a third party to conduct the survey, you should look for a registered copyright and the date of the registration of the survey materials under evaluation. Ask for that copyright registration to ensure that there aren't any copyright issues going on. And then, of course, in addition, the organization, if your organization has unionized unionized employee, you should provide appropriate notifications and advanced discussions to ensure agreement to include union employees in the survey. Think about your employee communications. Organizations need to prepare your supervisors and your managers with advanced information about the rationale for conducting the employee survey, the expectations, timelines, all of the communication needs and expectations that you'll have, and then the plans to follow up on the results and the questions that employees may ask. And again, for those unionized environments, it's a good idea to also brief the union representatives and stewards on the process and timing of the survey. It's important to think about what kind of technology you're going to use. At this point in time, 2022, most organizations use electronic surveys because they're more efficient and faster and use fewer resources. However, it is important to make sure that a paper copy is available for those folks who prefer that or need that based on their access to technology or their any disability or neurodiversity that they might have. And then the opposite of that, the ability to complete the survey on a mobile device like a phone or a tablet, it can also enhance the survey experience. So if you are using an electronic version, it's great to make sure that it's one that can be done on a mobile device, not just on a computer. And then in terms of the interpretation of your results, survey results should not be taken at face value, even those on the positive end of the spectrum, regardless of whether your organization is working with a third-party vendor or tabulating those results in-house. You'll need to assess the reliability of your data. And it's also important to determine the format in which you want to display those results. And again, that goes back to thinking about data storytelling and how you're going to utilize the data to tell a story that will help inform your next actions. And then, of course, to that end, survey follow-up is important to think about. So like I said, organizations often establish those cross-functional teams to create the surveys, but they can also be useful in responding to and acting on the survey findings. You should consider how you would like the team to be made up. Lots of organizations opt for a majority of the team consisting of non-senior employees to, again, help inform those actions in a way that makes sense for the majority of your employees. But it is also really important that each team is supported by that senior level champion whose responsibility is to monitor and support that team. And then it's important to think about what's next. How can you go beyond surveys? So in addition to the information that can be generated as a result of those employee surveys, some organizations also choose to initiate strategic conversations with some employees to explore the key issues more in depth. So if you see a trend come up in your employee or survey or your staff satisfaction survey, you can see if you have time, the ability to have those more nuanced, in-depth conversations with folks. And the hidden power of these conversations lies in the fact that they're not about data, but they are about that dialogue. And they tend to make employees feel really valued, really heard, and that increases that culture of engagement. And all employees need to understand that their employers will treat their opinions with dignity and respect. And if we can leave you with one thing today, I think that is maybe the most important piece, that throughout this whole process, make sure that you're treating your staff and your employees and their opinions with dignity and respect. So now we want to, hear from you again. So it's that same Mentimeter. So if you still have it up, you should be able to just refresh and go to the next slide. But if not, of course, you can re-type in mnt.com 69168922, or you can hold up your phone to that QR code. And our first question for you is, have you conducted a staff satisfaction survey in the past? And I'm going to stop sharing now and let Suzanne share the Mentimeter so that we can see those results as they're coming in. All right, cool. So far, the majority of folks have conducted staff satisfaction surveys in the past, which is good because the next several questions are an if yes, then. We'll give it another moment to see if anyone else wants to share. Great. Okay, we can go to the next slide. So our next question is, if yes, what was the frequency? So have you conducted them annually, biennially, so every other year, every 3 years, or just sporadically, you know, when it's come up, when it's made sense, or do you not know? So a kind of even spread across this answer, so that's interesting. We'll give folks some more time to answer, since that's technically we had 12 folks say they had submitted them in the past. So I'll wait for at least 11 people to let us know. So again, so far it's looking like fairly even, but with sporadically being the, you know, the most, which, you know, there's no set, this is the way to do it. There's all, you know, this is the only way you can do it. And so often we hear that it makes sense to conduct a staff satisfaction survey when you're able to be in a place to respond. So annually might not necessarily make sense, and maybe you want to do it more than annually. All right, we'll go to the next slide. So this one is also if you've conducted them in the past, what was participation like? So did you get 0 to 25% of your staff, 26 to 50%, 51 to 75%, 75 to 100% participation, or you're not sure? And if someone has had, I mean, I shouldn't say this, I was going to say, someone has had 75 to 100, we'd love to hear how you did that. But it looks like that one is not the answer. But 51 to 75% is honestly great. So again, there will be time later in this, and we've got 175 to 100%. So at some point during this learning collaborative, we're going to need to hear from that person for sure, and from some of these 51 to 75% folks to learn what worked, how they did that, and you know, and what happened there. So we'll go to the next slide. This one is also if you've conducted them in the past, what changes did you make in response to the results? And this one's open-ended, so we'll definitely give you a little extra time to type that in. And while you're typing in your answers, I'll just share. I can't hear the word sporadically without thinking about the movie Clueless, which is just a timeless classic.
I was on mute, but I chuckled at that, Helen, for those of us who are in that era.
It's a great movie. All right, so they made this, some folks made the survey shorter, not much, and that's why they're excited to be in charge of this one. That's a great note. They made some policy changes and classifications and process changes in operations. That's great. Some went to a flex time schedule to accommodate employees. That's a great change. Nice. That's awesome. We'll give everyone just a few more moments to fill that in. They didn't make any changes based on the survey results, but they want to change that. And then someone else had some changes for process improvement. Great. So yeah, so you can see that, you know, there are really easy things we can do, like make the survey shorter. I say that's easy, of course. It's really hard when you have all these questions you want to know to figure out which ones you want to cut. And then we have folks who are, who are excited to be able to make changes now in this one. And then some that made policy changes, timing changes, process improvement changes. We have another answer that's less questions, especially questions that could potentially identify responders, i.e. what office are you located at? Yeah, that's great. That's a really important piece, is folks will have a harder time being fully honest if they're worried that they could be identified and face repercussions. All right, cool. Suzanne, will you go to the next Mentimeter? I think there's one more. I might be wrong. This might have been the last one. This is the end. All right, great. Well, thank you all so much. Again, I think it's really important that we, you know, as we're starting this and as we're laying the groundwork, we're considering how we can best do these and we can learn from each other about what has worked, what has been changed already. So the rest of these are these guys. Now I'm going to hand it back over to Suzanne to talk about homework and next steps.
Awesome. Thanks so much, Helen, for sharing a little bit about some considerations that we need to think about when we are sort of really diving into this world of staff satisfaction surveys. And that's a lot to say, but we've said it a lot today. So anyway, so what we're going to do is during our remaining time together is we are going to go over our homework assignment and next steps, and really look forward to what we're doing with the rest of our time and our learning collaborative. Next slide, please. So the homework assignment that you all are going to have, will be posted after this session in our discussion board. And so what we want you guys to do is either to do it yourself, or if you have a team that is going to be working on these surveys with you, we would encourage you guys to just take 10 minutes or 20 minutes or 30 minutes and really sort of brainstorm about really putting together, your surveys and, and how you might respond. So really this activity is to really get you thinking about them in general and really just sort of honing in on the experience itself and really reflecting on it. So we want you to think about how the information that you put together on as a result of this homework really is going to help shape and respond to the staff satisfaction survey that you're going to implement as a result of being a part of this learning collaborative. And when you're done, you don't need to turn it into us. If there are questions that arise during it that you want to ask us, we'd be happy to do that. We're going to have some time during our next session to reflect on our homework if you would like to share. But we really just encourage you to keep the document and really take a look back. And once we're finished this experience, just have something you're able to reflect on. So take some time, take 30 minutes or so with your team, if that's applicable to you at your health center, go through it, and then, save it so you can reflect on it after experience is over. Next slide. And one thing I wanted to mention with that too is that there are no wrong answers. This is just, a sort of a brainstorming activity, and we, to really get you started in this work, especially for those who haven't done these before. And if you have done them before, that's okay. Maybe there's some things that you want to change or do differently, and that's really what that's for. So looking forward to, how you guys are going to get all this information. So Mariah sent you out a login to the discussion board, and we wanted to go through how you log into the discussion board if you haven't been a part of one of our learning collaboratives before. So at the very top of our website at chcworkforce.org, there's sort of a little tab at the very top. And one of the phrases at the top is log into the discussion board. So you're going to click on that, and it's going to take you to a login screen. You're going to log in, and then there are going to be, if you have been a part of a learning collaborative before, there are going to be whatever learning collaboratives you've been a part of, they'll pop up there. But obviously this one is our staff satisfaction surveys learning collaborative. And so you're going to click on that, and then there will be five dates that will be up there, and you will click on the one that is applicable to the one you're looking for. And there will be a discussion tab and then also a resources tab there. So anything that we have relating to our sessions will be in the resources. So our homework, our recording, our slides, all of that will be in the resources tab. And then we encourage you guys to post questions or thoughts in the discussion little section as well. You don't have to do that, but it's just something that it's available there to do that. And again, we'll have some time to talk about our homework, really flesh it out, really break into those small groups and talk about challenges or just thoughts and ideas that you might have as a result of the homework from the previous week. So that's the discussion board. Again, if you're having trouble logging in, feel free to contact Mariah and she will point you in the right direction. Next slide, please. So this slide, we just wanted to, thank you guys for being here today. We do have some exciting content to share with you guys over the next 4 sessions, so a total of 5 sessions. And one that we wanted to have you pay attention to. So most of our sessions are from 1 to 2:15 Eastern on Wednesdays, but our 3rd session, February 17th, is on a Thursday. So mark that down on your calendar. I know Mariah's already sent you guys all the Zoom links for all of these, so you have them on your calendar already, but just wanted to bring that up there as we get in our time together. Next slide, please. All right, and so these are we just wanted to leave you some, besides our homework assignment and our sessions, we just wanted to leave you with some resources that we have. There are a lot, we have a ton of tools and resources on our website that we hope that you'll check out. They're all in or a lot of them are under our original resources. All of these here that are listed are our original resources. And so as you are developing and implementing and responding to your staff satisfaction surveys, we have a ton of other tools and resources that could complement them on our website. Next slide, please. All right. So with that, we would love to open it up to questions or comments or anything else that you guys wanted to say. I know you guys were awesome at responding to our Mentimeter questions today. And so we're excited to get to know you a little bit through that, but wanted to open the floor to any questions that you might have as we are closing out today. And if you can either unmute yourself or you can put them in the chat. Either way, it's totally fine. And while we're waiting for questions, we'll go ahead and go to the next slide. Okay, so just a couple more resources that we have on here, and feel free to check those out again on our website, chcworkforce.org. And one more thing while we're waiting for any questions to come up, Mariah is going to launch our poll for today. And so before you log off, because we are getting ready to wrap up here today, we would really love it if you would respond to, not a poll, evaluation today. And yes, absolutely, you will have access to this PowerPoint. It will be on our discussion board. So under the resources tab on today's date, on January 19th, there is going to be the recording. There's going to be the PowerPoint. There's going to be the homework. And all of those are going to be there. And so again, if you're having trouble accessing those, feel free, Sheila, to contact Mariah at mblake@clinicians.org, and she will get you pointed in the right direction. So, and that was, sure, absolutely. And those will be available in perpetuity. So you'll always have your login to the website discussion board, and you'll be able to look at those, in retrospect if needed. All right, so our post-session evaluation has popped up. Thank you so much for all of your time and attention today. We really are excited to go on this journey with you guys, and looking forward to seeing you back here on February 2nd. And we are going to have somebody, an expert who is an HR consultant, and she is going to be talking to us about considerations for staff satisfaction surveys, best practices, and we hope that you guys will be ready to engage with her, ask lots of amazing questions, and also discuss our homework that we had this time. So thank you guys again for being here. Thank you also to one of my partners in crime, Helen, and Mariah, for being here. And we'll see you here back on February 2nd. And we'll give you back 15 minutes to get started on your homework there. So we'll make sure to post that homework there right as we end our session. So thank you guys. Take care, be well, and we'll see you back on February 2nd.